Hello, my name is Neil Srinivasan. I'm a consultant cardiologist and electrophysiologist. I specialise in the management of heart rhythm problems. One of the most common things that patients present to me in a clinic is with arrhythmias. And arrhythmias is really just an umbrella term for a whole variety of heart problems and heart rhythm problems specifically that patients experience. The most common symptom that patients present to me when they say, I think I've got an arrhythmia, is palpitations. Palpitations is a very broad term and they can mean different things to different people. They can mean the heart skipping a beat, they can mean the heart beating irregularly or erratically, they can mean that the heart sometimes beats fast or slow. And so, as part of my treatment of arrhythmias, I have to think about a wide range of diagnoses that could cause the symptoms that patients experience. It's also important to bear in mind that arrhythmias can present in more subtle ways. Patients can present with collapses, patients can present with breathlessness, and sometimes patients can present with chest pain, but actually the cause of the problem is that there is an abnormality of the heart rhythm itself. The first step in trying to understand these kind of conditions is to take a good history and understand within the patient's own shoes, what are they feeling like when they experience the symptoms? When do they occur, and how does it feel, and how often does it happen, and how long does it happen for? Once we've established that, we can work through a series of tests to look at potentially trying to form a diagnosis. The most common test I use to diagnose arrhythmias is to record the heart rhythm, and this can be done in two ways. Firstly, a simple ECG can often be very telling in terms of establishing the diagnosis. But more often we look at long-term monitoring the heart rhythm for periods of time such as a week or 2 weeks with a stick-on patch monitor, which will hopefully establish the diagnosis and the cause of the symptoms when patients are experiencing these palpitations or arrhythmia symptoms. Once a diagnosis is established, we can then go and look towards potentially looking at treatments. There are many causes of arrhythmias. One of the most common types of arrhythmias that I treat is ectopic heartbeats. These are extra skipped beats within the heart, which are normally harmless, but for some people they can be extremely troubling and cause a lot of symptoms. The good news is that this is often easy to treat and very straightforward to treat with simple medications or sometimes simple reassurance, because often these kind of heart rhythm abnormalities will go away on their own. Very commonly in young people, I see them come to me and they complain of very fast, rapid palpitations, a rapid arrhythmia that stops and starts. And the umbrella term for this is often something called supraventricular tachycardia, or SVT. And this is often in young people caused by extra circuits within the heart, an extra wire that is causing a short circuit and the electrical activity within the heart to misbehave. It's easily diagnosed and quite straightforward to treat, but reassuringly for patients it's very rarely harmful. The treatments here for these kind of heart rhythm problems often involve a similar pattern of medications or reassurance, but also for supraventricular tachycardia, there is an excellent treatment called catheter ablation, which involves taking fine tubes from the groin up to the heart, done often awake or sometimes with the patient asleep if they wish to be asleep for comfort and reassurance purposes. And the good news about supraventricular tachycardia is that if there are extra circuits within the heart, they're often treatable with a 99% success rate. So patients can be cured of supraventricular tachycardia through catheter ablation, a simple procedure which normally allows them to go home from hospital either the same day or the next day and live their lives normally.